Hello and welcome to this week's episode of For the Love of Chiropractic. On this week's show, you have a choice to make. You can either sit back, relax, listen, and take it all in, or, and I'm going to encourage this, you can really roll up your sleeves, sit up straight in your chair, grab a pen and paper, and get the answers to some really tough questions that you know deep down have been plaguing you so that you can go and grow where you want to be. So let's get started. Welcome to another episode of For the Love of Chiropractic. I'm your host, Dr. Robert Freeman. I've been in practice for over 30 years, and I continue to work in a $1 million practice that I built, ran, and sold. I've taught, lectured, and coached our profession, and helped so many chiropractors build the practice and the life of their dreams. And now, I want to help you do the same. So here's today's show. As I said in the introduction, on today's show, we're going to ask some questions. And you can let them just roll off your shoulders and onto your back and just ignore them if that's what you want to do. Or you can really dig deep, come up with the answers, well written, wordsmith, choosing words exactly and precisely. And by doing that, change your practice, change your life, and change the course of the rest of your life. So on previous episodes, snuck in the middle of some of the deep and great information that I've shared on those episodes, we've asked questions like, why did you become a doctor? And I'm sure you have an answer for that you give people all the time. And there's a reason deep inside that you know of why you became a doctor. And on other episodes, I've asked questions like, why are you a chiropractor? And there's an answer that you give people, and there's a deep answer somewhere deep down inside. But on today's show, we want to dig in and ask other questions. The first question is, what is the purpose of your practice? You know what? Or even better, tell me exactly what the purpose of your care is. And there are lots of easy answers to those questions. Well, what's the purpose of my care? To get people out of pain. Okay. What's the purpose of my care? Well, to help people be healthy, to help people be well, to bring people towards wellness. But what you say in a clear, concise, and precise way tells the outside world what it is you're doing, and perhaps more importantly, tells you in your heart and that space between your ears what it is you're doing with your head, your heart, and your hands every single day when you go to that office to perform the chiropractic miracles that you do with your patients. And I've known doctors over the years who, when I ask them this question as a consulting client, they'll say, well, the purpose of my office, the purpose of my clinic is pain relief, to take people who are in acute pain and get them out of acute pain. And if that's what you want to do, I think that's just fine. Plan appropriately and tell people appropriately that that's what you're doing. And I think you owe it to them to at least tell them there's a whole nother side that you choose not to provide. That would be things like corrective care and wellness care, other rehabilitative care. I've known other doctors over the years who say, oh, well, no, I do pain relief and I correct the underlying problem. We specialize in correcting the underlying problem of your issue so it doesn't come back. And again, I think that's terrific as long as you're telling them what it is you're really doing and at least mentioning that routine checkups are really important and need to be done as part of healthcare, because that's what healthcare really is. I've known other doctors who say things like, oh, we work to improve people's health. And while that sounds great, I don't know what that means. And I don't know if they know what that means, and I don't know if you know what that means. So if you're going to say we improve people's health, you better be ready to explain it in a clear, concise, easy way. So maybe that means helping the body work as close to 100% efficiency as possible. Maybe it's like your cell phone. It works really well most of the time, but sometimes it gets gunked up and it slows down In fact, maybe even you say, my phone is getting stupid. It's not working as well as it should. It's computing, but its computing power, its efficiency has been reduced. A lot like the human body when there's a subluxation. So maybe if what you're saying to people is we improve your health, we help you to work more optimally, or we optimize the functioning of the human body, yeah, what you're really doing is optimizing the function just like you do on your phone or on a computer or a tablet or anything else. And flipping the pendulum back the other way, if you're saying we reduce your symptoms to get you feeling better, well, how are you doing that? And neurobiomechanically, what are you really doing? And what's the effect that it has on the body long term? Are you just barely getting the person below the pain threshold? And if that's what you're doing, that's fine, as long as you're telling them that's what you're doing. You take an aspirin, it covers up the pain. Is it really eliminating the problem? But doctors tell patients to take aspirin all the time. And obviously, when I say aspirin, I don't necessarily mean salicylic acid. It could be any one of the other over-the-counter non-steroidal anti-inflammatories that we all know so well. But as you're working your way through this and figuring out what is the purpose of your care, the question behind the question is, why is that the purpose of your care? I know of a chiropractic consultant who tells people all the time that they have to change how they think. Well, I don't believe telling someone you need to change how you think really changes how anybody thinks. In fact, before you tell someone to change how they think, or obviously even yourself, the first thing you have to do is examine what you believe and why you believe that to be true. I've known lots of doctors who believe that they have to do certain procedures along with the adjustment, because if not, it just won't work. And yet on the other hand, I know chiropractors who do a great chiropractic adjustment, no others procedures, and their patients get better just fine. Is it because it's what they believe, or because that's actually what's so? The point of all this is examine what you believe and why you believe it. Really dig into that. This is the roll up the sleeves part. And then make some good, hard decisions about why you're doing what you're doing and the benefit and maybe even the detriment to the patient. I know a really good chiropractor who feels he has to do soft tissue on every patient for several minutes every time he sees them, because if not, they won't get better. And we've had the conversation of there are chiropractors who do the adjustment, find it, fix it, leave it alone, and their patients get better. And when I talk to him about that and ask him, how is that possible? He says, well, I don't know, but I know this is what my patients need. He's unwilling to change. He's unwilling to grow. He's not going anywhere. Or at least he's not going to change in that particular way. And when I've asked him, why is that you feel every one of your patients needs that? And he stops and thinks about it. He says, well, because when I was first out of school, the first job that I had working as an associate, that's what that doctor taught me, and I saw it worked really well, so therefore, that's what I do. This reminds me of the old story of the granddaughter who's getting married, and she's about to learn how to make the family roast using the grandma's old recipe. So the mother is showing her that you take the roast, and as you prepare it with the salt and pepper and the spices and everything else, you cut the last 3 inches off of the roast before you put it in the pan and put it in the oven. And the granddaughter says, oh, is that what makes the roast so good? And her mom says, I don't know, but that's the way that my mother, your grandmother, taught me to make it. So that's why we do that, because that's part of the recipe. Well, okay. Well, some time goes by, and the grandmother is at the granddaughter's house. And so, of course, she's making the roast for her grandmother to honor her as she's over there for dinner that night. And they're there in the kitchen chatting as she's cooking, and she cuts the end off and she puts it on the side and just before she's about to put it in the oven. And as she and her grandmother are talking, she said, "Grandma, I've been meaning to ask you for a long time. When Mom taught me how to make the roast, your special roast, using the special family recipe, you had to cut those last 3 inches off, and then you place it on the side because, well, she didn't know why. She thought maybe it cooked better, but that's just how you make it because it's so good. So why do you do that?" And her grandmother looked at her and said, "Honey, the only reason I ever cut the last 3 inches off was because when me and your grandfather were first married, we lived in a very small apartment, and the roasting pan that we had and the oven that we cooked in was so small, a full-size roast wouldn't fit in the pan and in the oven. So you had to cut off about the last 3 inches, and you wouldn't throw it away, so you put it in the side so it would cook and you'd have the whole thing." And what I'm saying is, maybe there's things that we do that made sense at one time that don't make sense anymore. Maybe they really don't need to be done. Maybe people only need what they really only need. And the only way you know what they really need is to stop and examine what it is you believe, what it is you're telling them, and how it is you're providing to them the things that you want to be providing to them. But let's turn the page and ask another question now, or ask the same question from a different side. If you're a doctor that does a lot of personal injury work, and I think that's great because these people need care and they need the help, what is the purpose of that care? Typically, it's to get someone back to pre-accident status. Is it your job to get them to maximum health? Well, that may be your job. That's up to you to decide if that's your job. It's not the job of the insurance company to pay to get them back to maximum health, or the person whose fault the accident was, whether it's an insurance company or an individual. But is it your job as a doctor to at least inform them that there is more health to be had? You know, you had some minor neck pain and some degeneration before the accident. You told me that. And now it's severe. The headaches are severe. The neck pain is severe. You can't sleep at night. Whatever the symptoms are, and the positive orthopedic and neurologic and chiropractic tests. But is there a conversation to be had of, we're going to get you back to pre-accident status, or as close as we possibly can, but let's say pre-accident status. And then what? Okay, goodbye and good luck. Or you've gotten to where you need to be based on the injuries from the accident, but there's more health to be had. I think you should be as healthy as possible with this life that you're living. And here's additional care that you require. Now, if you as a personal injury chiropractic physician choose not to provide that care, that is fine. No one says you have to. But I believe you have a moral and ethical and even legal obligation to tell the patient that there is this possibility and they should at least consider it and look into it. And you know what? And if you choose not to do it, again, that's okay. But you have a moral obligation, a legal obligation to make the appropriate referral, just as you would for any other condition that requires attention from a qualified specialist, a qualified healthcare provider, a qualified doctor, a qualified doctor of chiropractic. And as we've talked about on some of the other episodes, I've done the research, I've done the reading, I've spent time doing literature searches and reading those articles, and what they show is that it takes about 40 visits to clear a spine and get it to be working biomechanically normal, along with a series of checkup or maintenance or wellness visits, whatever word you like, because that's just what it takes. If you haven't done the reading, if you haven't looked at it, you're welcome to take my word for it and believe me. But if you're not recommending that kind of care to your patients, you're just not correcting their spine. You're not correcting the underlying problems. Very simply put, a great chiropractor that I know who practices in Northeast, in fact, he's agreed to be a guest on a future episode of this show, simply tells his patients it takes about a year. Well, and when you do the relief, correction, and strengthening, and then throw in the maintenance on top, yeah, that is about a year to correct a spine properly. So doctors who are not telling their patients that are just not giving them an honest view of what's really going on physiologically, neurobiomechanically. You can do what you want, obviously, but are you really doing what's best for the patient? Are you rolling up your sleeves and examining what you believe, or are you simply doing what you've always done because that's what someone told you early on in your career, without examining it and looking at it for yourself? What's really going on? When you do just a couple of adjustments, of course they feel better. Of course they think you're the best thing since sliced bread. But if you haven't changed the alignment, if you haven't really corrected the curves, now I'm using some of the information from chiropractic biophysics, and creating a proper aligned spine, biomechanically, it's simple vector physics that the spine will continue to degenerate because the forces are going through it not on the optimum angles, and therefore things are wearing out. There's stress where it's not supposed to be. The articular cartilage grinds on itself, leading to osteoarthritic changes that we all see on x-rays all the time. And for some of these doctors, when the patient asks, well, how did they get this way? They simply respond, well, it's a normal part of the aging process. And nothing could be further from the truth. We've all seen patients who are in their 70s, 80s, and 90s, and their x-rays look terrific. And we've all seen patients who are in their 20s, 30s, and 40s, and their x-rays look like they're in their 70s, 80s, and 90s. It's the wear and tear, not the mileage. It's the care you've taken of the spine. Is it aligned properly? This system is designed to work in a beautiful, perfect way for an entire lifetime, not become decrepit and fall apart. So as you're deciding what is the purpose of your care, I really think you need to also dig deep. Look at your beliefs, what it is you know versus what you've been told. What have you seen? And are you willing to step outside that box, look larger, and take different considerations into place? I imagine a generation or two ago, when dentists were notorious for drilling and filling and nothing else, well, maybe pull them, that's all they would do with teeth. When the idea of preventive dentistry came around, that there were an awful lot of old school dentists who were like, nah, they're just stealing people's money. That makes no sense. You wait till there's a problem, then you come in, and when the problem's gone, you go away, and the next time you have a toothache, you come back and see me again. And in today's more enlightened, educated world, that viewpoint would be considered malpractice. In fact, if the dentist didn't say you should brush and floss, there are certain things you should do to take good care of yourself on a regular, ongoing basis, I think that dentist would find himself before the licensing board because that's not the standard of care. Well, what is the standard of care in chiropractic? What do you think it should be? What would you want for yourself, for your family, for your loved ones? What would you want their health to be? I think we should all dedicate ourselves to getting as many people as possible as close to 100% of health as possible. But it all starts with you asking yourself, What is the purpose of your care? What is it you're providing to people? And how healthy do you want them to be, and for how long? And if you've taken the time to really answer those questions, as we've said on previous episodes, and some of my guests have said and echoed as well, if you don't tell them, if we as the chiropractor don't tell them, nobody else is going to. I don't care if they think you're crazy. They're going to know you're telling the truth. And over the 30 plus years that I've been in practice, we've seen that what we've said actually is the truth and has become the mainstay. So why wouldn't you tell the person the truth, even if right now it sounds a little bit crazy? Because as soon as you stop and think about it, it just makes perfect sense. All right, and that's our show for today. If you have a question about today's show or your own practice, feel free to reach out at fortheloveofchiropractic.com. Before making changes to your practice, be sure to seek legal advice regarding those changes and regulations in your state. For the Love of Chiropractic is an RGF production, all rights reserved. And thanks for listening. Original music provided by Hunter Rich Music.